Congratulations on winning the bet. I think you know that my colleagues have spoken with yours and that money will be paid today. So well done. Congratulations to you and your team for pulling that off.
Very good to talk. You're paying it to Hospices UK, is that right?
Yes, that's right. All done. Yeah, absolutely. Well
Fantastic.
done. And never have I been happier.
More importantly, we now have a large-scale testing capability in this country, and that's the thing that really matters.
Never have I been happier to lose a bet, Secretary of State, I assure you. Now, there are concerns about this app. I spoke with Professor Sir Jonathan Montgomery, who, among other jobs, oversees the NHS contact tracing app and chairs the Ethics Advisory Board. He's talked about mission creep. What assurances can you give to my listeners, Secretary of State?
Well, there is a really, really important mission for this piece of technology, but there's only one
data.
Mission.
He's concerned that the data isn't allowed to creep to private companies, and that it is kept absolutely ring fenced.
That's right. The purpose of this technology is to help get Britain back on her feet by being able to trace the virus. That is the only reason for it, and the data that this app picks up will be stored on your own phone until the point where, if you have symptoms, you need to contact the NHS, when obviously we need to know who you are so we can get you a test. So this privacy has been built in from the start, and it is incredibly important that people download the app, because it will help to save lives and it will help us to control the spread of the virus, and so to reduce the amount of other social distancing measures that we need.
But how will it be policed? How would you stop people doing it with malevolent intent? Saying, for instance, a school pupil, I've got coronavirus, and they have to close his or her class.
Well, it is. The reason is because you get tested. And if the test result comes back negative, then obviously there isn't an impact.
Right, so it's not until you're tested. Right.
And anyway, people in this country have been incredibly community-minded in terms of following the social distancing rules.
And how long do I have to have been exposed to someone for it to register?
Around 15 minutes.
But you'll know better than I, Secretary of State. I just need to be sneezed in the face and I've caught it.
Well, of course, that is the best scientific estimate rather than an absolute, but that is the best estimate that we've got. And that's why you can't just use technology alone. It's also about having people who are contact tracers being able to go out and, when somebody tests positive, go and talk to them, find out who they've been in contact with. And if they say, well, if say you tested positive, and the app would say that who you've been in within 2 meters of for more than 15 minutes, but then they'd also phone you up and say, Nick, who have you been in contact with? Who have you spent time with? Who have you sneezed over? And he'd say, I did sneeze over Matt Hancock, but we were only in contact for about 2 minutes, so the app wouldn't have picked it up. But if you remember that, then they'd contact me as well.
But in some instances, of course, not you or I might have been in contact with people I shouldn't have been as regards other matters of my life. That knowledge, that information could be rather sensitive for the tracers to pick up on.
Well, that's not something that I really got any experience in, so
no,
I
course.
can't.
I appreciate that, but others have, and that might deter them from coming forward, Secretary of State.
Well, it may do, but really, this is anonymous,
right.
So the phone might ping to somebody you've been spending more than 15 minutes with.
Yeah.
They wouldn't know who they'd been in. They wouldn't know who that was from. And you don't know who you're pinging. The whole point of it is to keep that private. So actually, that's far better than a human contact tracer, because you obviously have to tell the human contact tracer who it might be that you spent time with.
We hear the Nightingale Hospital in London is going to be stood down, I think is the expression. Was it worth the effort? And is it true it never reached full capacity because it wasn't fully staffed?
I think it is a very, very positive thing that we haven't had to use the full capacity of the Nightingale, and absolutely it had the staff, and we would have put more staff in as and when it had to fill up. That wasn't a problem.
What did it cost?
News. Do you know what? It isn't finished yet. The project isn't finished yet.
I thought we were standing it down.
No, we are putting it on standby. So it still will be there in case there's a second spike.
How many staff?
We don't want to have a second spike.
No, indeed, sir. It has fewer than 20 patients, I understand, the London one. How many staff are there?
I don't know the exact number this morning, but we had the staff necessary, and also
how many
then
staff
ready to
typically would there
expand.
be for a 4,000 bed hospital? I mean, no, what are you talking about? 5, 6?
No. More. You have more in these for these people in critical conditions. You have more staff than patients.
So we've had 6,000 staff there looking after 20 people.
No, we haven't. We had.
How many staff have we had?
I'm so sorry, Nick. I don't have the figures in front of me, but what I can. What I'm trying to explain is that we had the staff needed to take up to 500 patients, and then we had the plans ready to expand it further. So the staff weren't an issue. The good thing, or the number of staff, I mean, it was fantastic how many people came forward saying that they wanted to help and support and work there. But it's funny, I've seen some media reports saying, the London Nightingale Hospital isn't needed anymore. What a scandal. It's absolutely fantastic for the nation that we haven't had to fill up a 4,000 bed hospital with people with coronavirus. And instead, it's good, right? It's because the overall objective, the number one objective of me as health secretary in this crisis has been to flatten the curve to control the spread and to make sure there's always been enough NHS capacity, and we've achieved that.
And lastly, Sir Keir Starmer is suggesting a national consensus before moving on to the next phase of the lockdown. Do you think the government would be interested in pursuing that?
I definitely think it's worth talking. Yeah. With my opposite number, John Ashworth, who I think has been absolutely... I think he's been really, really positive in this crisis and very, very responsible. On the way in, we had talks with the Labour Party and made sure we kept them posted of what we were doing, and they were very supportive. And I think having those discussions, because this isn't really a political thing, this is a war, Nick, against the virus, and we're all on the same side. And so I don't think there's any reason for party politics to get in the way of getting the national response right.
And so that would national consensus, how would it look in your view, lastly, Secretary of State?
Well, I think that's for the Prime Minister to have a conversation with Mr. Starmer, and I know that Mr. Starmer has been...
You keep demoting him. It's Sir Keir, of course, Mr. Hancock. You're aware of that.
Oh, Sir Keir, I forgot. Anyway, I know that throughout, whatever his title, I know that throughout he has been kept informed by the Chief Medical Officer of the science, and I know that he met Dominic Raab when the Prime Minister was away ill. And so I think this is entirely reasonable. We should all be working together because we're all on the same side against this virus.